I recently got my license as a clinical psychologist in the state of Oregon, and for me that was a very, very long road. And I will admit that I beat the odds. I beat the odds because I was born in this country, and we value public education of individuals with disabilities. And so I'm very fortunate to be where I am, and I want to use that education to give back. Most recently, I was a resident at the Department of Vocational Rehabilitation here in Portland, and I worked with people who hadn't been employed for quite some time as a member of their a vocational team. And I provided psychiatric services to my clients, who in some cases had long-term diagnoses like anxiety disorders, like recurrent depression, like personality disorders that had kept them out of the workforce for a number of years. And I tried my best, and in many cases succeeded in giving the clients the tools to get back into the workforce and be more productive. But I worked with an individual who had had a really, really, really bad day at work. I mean, we all have bad days at work, right? But this guy was afraid that because of the way that he handled anger badly at work, he was going to lose his job. And so he called me in the parking lot, and he was terrified. And his speech was very rapid. He was very, very upset. And I talked with him for 30 minutes or so. And the first thing I said is, you have to get your body back under control before you get your mind back under control. And we went through some relaxation exercises. I said, what are you thinking? He says, well, I was really, really upset, and I think I just lost my job. I said, well, what evidence do you have of that? He said, well, I've lost my job in the past, and we've talked about that in therapy. Don't you know the evidence? I said, yes, I do know that this has been a problem for you for a very long time, but you haven't lost your job yet. And we have an opportunity together for you to have a different experience of not losing your job at this moment. And the way in which you don't lose your job is you need to have the courage to go back in there and apologize to your coworkers and talk to your boss more appropriately and just see what happens. The fact is that this individual was able to go back in, was able to talk to his boss, and was able to keep his job. And I presume that he's out there being a more productive member of society as a result, in part, of those skills. The people that use drugs and have used drugs for a long time have some of the same issues. If you as a taxpayer cut addiction services, then what you're saying is that it's not important to you that there is an individual who has tried everything, in many cases, has tried everything that they're capable of trying and cannot shake a long-term psychological and medical addiction to a substance. And in terms of the amount of public dollars that is used to fund those services is extremely minimal in terms of the potential long-term payback for these patients. It's a very specialized profession that if people went into the private sector, they could earn more money than they often do in the public sector in these kind of jobs. But people do it because they realize that, one, they have the skill to do it, and two, it's a significant societal issue that really needs as much effort put towards it as is possible to optimize these people's lives. Addiction is a disease. It's not a person's fault that they're addicted to a substance that currently. They made choices to get to that point that can be changed, but often they can't change those choices unless they've had the appropriate intervention. So that they know that they can think differently and they can behave differently, and the substance is out of their system and it's not affecting their biology. But if you don't give them those choices, then the behavioral patterns will continue, and it's going to be a great cost to society. But I would like everyone to live as close to their human potential as possible. I just want people to have stable jobs, stable life situations, and medical care that doesn't break the bank. And sometimes you can't do that without public support.